Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Monday, February 8, 2021. Well, it's the day after the Super Bowl, and yes, I've been told I have my Monday face on. So, that Super Bowl last night, I'm probably one of the biggest sports fans that you'll meet, but I could care less last night. And that's was one of those deals that is just one with everything going on in the world over the last year and the last few weeks. And I just wasn't as pumped as I was. I had a great time eating some food I'm probably not supposed to eat because it's Super Bowl Sunday. But, as we go into Monday and get into the numbers, that's kind of where you guys want to get. So we won't relive Super Bowl stuff. We'll go straight to the numbers. And my clicker will catch up to me in a minute. But from a numbers perspective, they stayed the same as the weekend. And we're going to look at some across the region that are going up. But from our perspective in Region F, which is Northeast Texas, you can see COVID bed as a percentage continue to go down. And this is as of Saturday. We saw a little increase yesterday, so I expect the numbers today that you'll see on the other slide to go up a little bit. But we're at 11.1, by far our lowest that we've been as a percentage. Continue to go down. We did see a pickup in the ER yesterday and some things going on. This is the Tyler area, which is 11.7%, almost right in line with us. That's the first time they've been that close to us in quite a while. So I'm happy for our friends down south in the region. And then there's a Dallas area to our west sitting at 15.7. So almost to that 15% mark that they've been looking to get to. So the numbers have gone down. You saw as of yesterday, though, that spike up for the region a little bit. Saw a little bit in the hospital with that increase, but you can see from 118 to 121. And then ICU beds kicked up a little bit in this region, going from 46 to 52. So that was one of the things a little concerning just going in from the weekend. That was going to this new week. Would love to see that continue to trend down, but that trend up just has us nervous. In the Tyler area south of us, you can see that number continue to go down, no peak or jump up, and the ICU bed stayed flat when they were the previous one. Dallas area the same way. Now, Dallas was consistent with us. They saw that little increase on Sunday, and then you saw the ICU beds go up from 561 to 654, a big jump in those 1 days. At 656 to 654, was there something going on in the reporting or what was going on? But you look at that. So 654 is where Dallas is, so staying pretty consistent where we're there. So, but just staying on the numbers as we talk about it. And from a Titus regional perspective, we sitting at, we had 13 people in the hospital today, 3 in the ICU, 10 on the floor. We've maintained that number. Last week we were at 14 and 15 most of the week, and then right now we're sitting at 13. So it's a good number. I'd love for it to be 0. Can't lie to you. But, as we continue to see down, we saw a little bit increase yesterday, but it has not been dramatic. Greg's asked on the chat box here, do we expect a Super Bowl surge? Across the nation, they're talking about it. I've watched a lot of things, listened to a lot of podcasts. I've kind of changed during COVID from a guy who listened to talk radio and different things or watched TV to a guy who watches podcasts and listens to the podcast all the time now. And, from what I'm hearing, there is a concern. And when you put that many people in a restaurant, a bar, and yelling and screaming and just that stuff is going on, you're going to see an increase. And I think they saw that around Halloween. We definitely saw it on Thanksgiving and Christmas. So we saw that. So would we expect a surge? Yes. Now, I hope the surge is not as much as it was because we're getting the vaccine and we're getting it out there. So that's a great segue into our vaccine topic. So I appreciate questions that help my updates. But from a vaccine perspective, we just found out a few minutes ago we will get 1,000 shipment of first dose this week. So we'll start when we get our hands on it later this week. We have confirmation that it will be shipped this week. So when we get hands on it, we'll start getting those 1,000 first dose to new people. So that will go against the ones that are on the list, focusing on 65 and older, and we'll try and get that this week to them. We're also going to start getting a few second dose this week, and I think if you saw the article in the paper and a lot of things going around, you can hear a lot of stuff about second dose. And I just want to tell you, we're trying keep things, when we know things, we hear it, we get it to this group, so we're transparent. As the state sends a second dose, we will get it in the people's arms. We are going to get 200 doses this week, and we're going to get those in people's arms. So it'll be a little later this week. We'll get our 200 doses. We've asked for more. We have 400 more coming at some point. We have actually 500, my bad. We have 700 total second doses that we'll be looking for. As we get those second doses from the state, we will get those to the people who had the first dose. But the state dictates if it's a first dose or second dose. We follow their guidance. We are closely monitoring the state. Kathy and the team and Michelle stay in close contact with the team at the state, so we understand where we're at. But I received that number on 1,000 just a few minutes ago. So we get allocated at some point, but you wait till you get a shipment FedEx number. That's what you're looking for. Question, guys, how soon can we get the vaccine after you're positive? Well, it's supposed to be 10 days or 2 weeks after you had your no fever, you can get it. Now, there's a little caveat there, and we'll publish. It's a great question. We've been asked before. We'll publish on Facebook from Dr. Thurman the exact guidance. We'll get that out there today. But if you had the antibody shots while you're in the hospital or outpatient, it's 90 days from you had that. So like my mom had COVID, but she did get the antibody, the IV. Since she had that shot, it's 90 days from the shot. And they told her that when she was in the hospital, that it would be 90 days from this. So I want to clarify that because sometimes those words can be in the timing, but we'll put something on Facebook to specifically, it's a great question. And we'll put that out there so we can get that to everybody and see on when you can take that, the vaccine. And we still would encourage, even though you've had it, there's no proof you cannot give it again. So we would encourage you, whenever you're eligible to take it, get the vaccine again. Just want to give the update as we're doing the shots and getting the vaccine. Please continue to use our wait list and the survey that's out there. Just go to our webpage. Want to give you a heads up. If you go right now, it's going to be down. We had to take it down late last night, early this morning to do some maintenance. So we're getting that fixed today. We'll get it back up as soon as possible. So if you went out there right the last few minutes, or as we speak, if you go out there, you're going to see that it's under maintenance. Our goal is by the end of the day today, that'll be up. So just want to get that out to you guys so everybody is aware that it's out there. As we continue to look for other things and look at things going on, one thing I just want to make sure everybody in our community, you're going to see us come. I'm going to write a couple letters this week or the next few weeks just talking about the hospital's open. And yes, we have COVID. And yes, there's things going on with COVID, with the Super Bowl, and then just other things will continue to go down. But we've made so many changes over the last 9 to 10 months to improve the safety of the health system, the safety of your physician practices, the safety of going to the ER, the safety of having surgery. The hospital has to change where we were 9 months, 10 months ago, and be able to operate in a COVID environment. So that's what we're doing. And I applaud our clinical teams of what they've put in place and our physicians of the different things they've put in place to make sure that we are having a safe environment here at Titus Regional Medical Center. And I'm truly proud of what we're doing. This is Heart Month. Cardiovascular Month is February. So I love this quote that was given to me, just talking about the history. So a lot of you like history, like me, enjoy finding out why things happen the way they are. But President Lyndon B. Johnson, LBJ, from here in Texas, 57th year we've put on the spotlight. It's the number one killer in Americans. And we talked last week about Go Red for women and Go Red for Cardiovascular Month. Number one cause of death in the United States is heart cardiovascular disease. Number one cause for death in East Texas, cardiovascular disease. The number one cause of death in our area for Titus Regional Medical Center is cardiovascular disease. Our number one transfer up until a few years ago was heart disease. The improvements that we made in the addition of Dr. Sekulich, Dr. Abbas, and Dr. Siegel and their teams to Titus has reduced the number of transfers. We're able to handle so many of those cardiovascular issues at Titus that it's usually not the cardiovascular reason why we're having to ship away, but some of the underlying things that may or may not have here at Titus. But it is the number one killer of Americans, and we will continue to invest from our perspective in cardiovascular disease and fighting it. Again, I truly appreciate you joining us. We will continue this on Wednesday and Friday of this week up until it gets nothing that for us to give news on. But we'll continue to give these updates each week. I appreciate you following us. I appreciate your patience as we work towards vaccinating the Northeast Texas community. Thank you, and God bless.